Well, now we're going to talk about the lumbar spine, the lower back, okay? This is a model of the the lower thoracic spine and the lumbar spine. We have 5 lumbar vertebrae. And as other vertebrae, they have an anterior part, which is called the body of the vertebra, and a posterior part, which is called the arch. And the arch is formed by the lamina here and the spinous process here, okay? Each vertebra joins the lower and the upper vertebra by the disc itself, which is a joint, and also the articular processes. These articular processes poses a lot of work within the movement, or normal movement in the spine. The normal movement of the spine is a little bit of flexion extension in the anterior axis of the body, but it's minimal between each 2 vertebrae. When you bend over not because of your spine it's bending. It's because of your hips, which are down here, while you bend over. So when we do surgery of the lumbar spine, even if we put implants like transpedicular screws or rods, you won't lose any kind of movement to bend over. Just lose the movement between 2 vertebrae. And when that is abnormal movement, like rotation, excessive rotation, or even translation between 2 vertebrae, we can fix that with surgery, okay? Remember that between each 2 bodies, there is a disc. The main cause of radicular compression or compression of the nerve, it's because of herniated discs. I'm gonna show you a model of that. Here it is, a normal model of the lumbar spine. You can see the shape of the vertebra and the height of the disc. And in a transverse cut, we can see the fibrosus annulus here and the nucleus pulposus. These structures are the normal disc, okay? When the disc breaks, it breaks first the annulus fibrosus and gets the nucleus pulposus traverse or migrates through the annulus fibrosus. And when that happens in a big scale, it happens on herniated disc like this. And because of the nerve root exiting at that level, it can get compressed and it produces the sciatic pain, which goes from the lower back to the bottom and to the leg. According to the level that is compressed, it's going to be the location of the pain in the leg. You can also feel numbness, tingling, peaking, or have loss of strength in some parts of your legs.